Hey folks, Dr. Steve Garber here. Today I would like to discuss with you a common malady or painful condition that presents to my office, and that's hip joint pain. There are two main reasons why someone might experience hip joint pain, and they're the two D's, dysfunction and degeneration. With hip joint dysfunction, we have a contracture of the soft tissue around the hip joint, typically due to adhesions, which are broad bands of fibrous scar tissue that form around an injury site anywhere in the body. It's almost like a spider web trying to engulf the area. And what it does is it causes tremendous restriction of movement and pain with that movement. Specifically, when we talk about the hip joint, we're speaking about what is anatomically known as the iliofemoral joint. And that is the joint that most people understand as the hip joint, the ball and socket joint, the most superior end of the femur where it joins the ilium or the hip. It's where we get a lot of mobility. This is where we bend and we twist. And it becomes a tremendous source of disability when it causes pain with every step that we take. For hip joint dysfunction, we would go in and do manipulation, mobilization, soft tissue stretching, and exercise to get the range of movement to return by stretching those soft tissues back to their normal or original length. For hip joint degeneration, which is a result of diminished cartilage in the joint, usually due to pitting or wear and tear, so that you actually have bone and bone. Once again, the important thing is to try and keep that joint from seizing up, which is what it's trying to do. As the cartilage thins and the bones come closer together, the range of movement within the joint is diminished, and the less movement in the joint, the more quickly the degenerative process appears to advance. So we must get in there and mobilize it, and then give you a series of exercises to keep it mobile. So if you're experiencing hip pain and you just don't know what to do, you've tried some of the medical approaches, maybe pharmaceuticals, prescriptions, drugs, over-the-counter remedies, and it's just not getting any better, here's what I'd like you to do. Give us a call and set up a no-charge consultation where we can sit down together and discuss the nature of your hip pain and see if it can be helped through chiropractic procedures. If you have any MRIs, CTs, or X-rays, please bring them along with you and I will read them at no charge. So stop suffering and let's see if we can help you. Give us a call today. Take care.